I want to really thank you, like for joining us. As probably you know, we have been streaming for, I don't know, 6 hours, seven
You
hours.
must be totally very tired now, no?
Yeah, I am, but like seeing both of you
Yes.
here kind of like
Okay,
gives
new
me
energy.
That's good.
exactly. And I know that both of you were on the streets, like
Yeah,
today,
yeah,
right?
yeah.
That like Mary was holding up like a in-person and virtual rally with the Ain't I a Woman campaign.
That's
Uh,
Uh-huh.
right.
and Sylvia was also outside on the streets in Washington Square Park. Um,
Yes. Yeah,
so
there was a very beautiful ofrenda, a very beautiful altar with pictures, some sisters from all over the continent.
wonderful. And what about you, Mary? We saw some images from the rally. Actually, like almost like
Yes. Yeah. Thank you so much for sharing that content. But we did have a in-person rally in New York City. Unfortunately, I'm up here in Buffalo, so I was not physically on the streets, but I was on Zoom and helping bring together some of the folks from other parts of the state to talk about the 24-hour workday that home care workers are being forced to work
Right.
and how to fight against that.
Well, I mean, thank you for after such a long day coming here, like and gathering. So I would like to, like I would like to ask you to, I mean, introduce yourselves. I wanna sort of like reintroduce myself because I did like 6 hours ago. And like most of the transmission, the broadcasting has been in Spanish, so I'm now slowly going back to English. Well, my name is Jimena Bustamante. I am part of the Undocumented Women's Fund and also Women's Strike NYC, which is a collective at the crossroads of labor, feminist, and immigrant rights organizing. And well, I mean, today, as you know, we have been hosting this trans-local sort of like day of action with the compass from multiple localities across Latin America, the US, and Europe. And well, I mean, it has been a very sort of like inspiring day. And now I would like to hear, like who each of you are. I don't know. Mary, do you want to go?
Sure. My name is Mary Lister. I live here in Buffalo, New York, and I organize with the Queen City Workers Center. And we are a part of the Ain't I a Woman campaign. And also, many moons ago, I was a student of Sylvia Federici's at Binghamton University studying
Yeah, you look familiar.
Yeah.
Right.
It's good to see you again,
Now I
Sylvia.
see. I said, I kept thinking, I know this woman, I know this woman.
Okay, good.
Yeah,
So,
I'm teaching there again right
Oh,
now.
nice.
Yeah,
Sylvia, would you like to introduce yourself?
yeah, I'm Silvia Federici and I live in New York. I work with a collective called Feminist Research on Violence. And I've been a teacher 50 years and also write. I've been involved with the feminist movement since the age of reason.
Actually, earlier during the day, we have a couple of feminist collectives from Santa Cruz, Bolivia, and they were actually having a discussion on your book, or Caliban y la Bruja.
That's right.
Like a full segment was about them discussing that and how it relates to their local struggles. So I'm
Yeah.
happy that we began with that, and now we are ending with this. Um, so, so look, I would like to ask you a few questions tonight. Something that I mean, with the Women's Strike NYC, we have been threading this translocal network, and like we are really putting a lot of emphasis on localized struggles, right? And paying attention to sort of like the different positionalities, like geographically and socially that sort of like each of us occupy. But of course, we have been seeing. I mean, the reason why this is possible in the first place is because there are a multiplicity of parallels, right, between localities. And what we have been seeing now during the pandemic is some of those sort of like systemic sort of the systemic cracks, like have become the visible, right? Like cracks of the system. So for instance, we have been seeing how the dismantling of the systems for the sustenance of life in common, such as like housing, transportation, healthcare, education, have become extremely visible during the pandemic, and the way in which they are interlocked, right? Like has also become visible. So I guess that what we would like to hear from you is from your standpoint, geographically and elsewhere, like could you tell us how do you see that dismantling of the systems for the sustenance of collective life, like during the pandemic? How have you seen that become more acute?
Mary, you want to go?
Sure, I'll start us off. So it's been really bad. So here in Buffalo, New York, there have always been problems with lack of food security, especially even before the pandemic. I believe about 1 in 4 children in Buffalo was going to bed hungry every night or unsure of where their next meal was going to come from. And the pandemic has only made it worse. So we have seen bread lines and, people just desperate for food in a way that I don't think we have seen since, the Depression era. So that has been very negative, specifically with some of the work that myself and others at the Queen City Worker Center have been doing. We've really seen, how broken a lot of even the safety nets are. So for example, one of the main things we have done in this past year is reach out to workers who became unemployed, many of them because of the pandemic, other for other reasons. And what we've seen is that even just the process of getting that unemployment money that many of them are owed it's filled with so many roadblocks. For example, at the beginning of the pandemic, the only way that you could get through and put forward an unemployment application was to do it online. But many folks in Buffalo do not have internet access at their homes or do not have a computer at their homes to do this from. And so it really just showed how broken the system is, that you can't even access the few little resources that there are left as a safety net. So I would say it's been very desperate. And also another thing that we've seen, which is related to what you asked, is issues with workplace rights, where workers just really feel that they have no power a lot of times. We have gotten calls from childcare workers, from workers in the manufacturing industry who have been forced to go to work under just completely unsafe conditions with COVID. And they are really, being told either you work under these unsafe conditions or you have no way to support your family. Those are the two options that they're being given. And so I think that it really, the lack of systems meant to sustain life has really meant that people have had their power stripped away from them and are being forced to choose options that really are not okay, and that they shouldn't have to be forced to choose. And so we're really trying to, slowly bring folks together and really fight against this and try to find ways to sustain each other, but especially find ways to fight against the system that's making it so hard to even just survive.
Totally. Silvia, do you want to say?
And I think much of the same could be said also about New York in terms of particularly food supply. The entire area that could be defined as food deserts, and where even to get access to fresh food has been long, even before the COVID, an impossibility. But above all in New York, what we're seeing, first of all, is the results of years and years and years of determined dismantling of the healthcare system. I don't know if people are aware that for the last 20 years in New York, about 119 clinics have been closed. I mean, practically so many clinics, precisely those who have served those who have less resources, have been shut down with the argument that they were not productive enough, they were not making enough money, and so on, right? I mean, and then of course you found that comes the pandemic and there is no beds, it's particularly the first few months were absolutely, chaotic. And this is like the richest town in the world, one of the sites of the biggest accumulation of capital. That's where the money that is being robbed across the world is being accumulated. And yet you had nurses for weeks who had to use plastic bags because they did not have, the hospital was not equipped with sufficient, PPE, protective equipment. And also we have seen the results of, racial injustice and the environmental racism. The largest number of people who have been infected have been in the Bronx, and the Bronx has been known, I always say COVID has intensified and made more dramatic crises that have been there all along. The Bronx has been known as one of the most polluted areas in the city. And it's a place where children after a few years are bullied because people already come with immunity systems that are, but the immunity system, the pre-existing condition really is a government, is a city government, a national government who doesn't care for people. And the same thing, also, apply with the whole migrant people. New York is a city of migrants. Many of them are so afraid also of using public facilities because they might be undocumented. And so that has been, and particularly during the Trump period, but even now, many people are really afraid, even in terms of the vaccine. And the other things is the nursing home. As you probably know, there is now a scandal with Cuomo that it constantly underplayed the number of people who died in the nursing home, giving it a sense of security to family who continue to send their elderly, and meanwhile people were dying, right? So there's this very cynical and deliberate decision to dismantle all the reproductive services. And this, I think, International Women's Day, this has to be at the center of a strong feminist movement, of a strong feminist mobilization. We all know the slogan, placing life at the center. This is the moment more than ever to do that.
Right. And following upon that of placing life at the center, Sylvia and Mary, what we have been seeing during the pandemic is that how lives are sort of like valued differently, right? Like systematically valued differently, right? Like, and one word that has been used a lot is this word of like essential labor, right?
Yeah.
Like, and there have been like institutional decisions about like, like who is essential and who's not. And something that has been very interesting to me also, I mean, given the work that, I've been doing with many others in the Undocumented Women's Fund, is seeing how in New York State, for example, home care workers were kind of like deemed essential, like officially, right? But nannies and other type of domestic workers were not deemed essential. And the argument was they will only qualify as essential if they are working for healthcare workers or taking care of children of healthcare workers, right? So with that, we see like this stratification within care work itself, right? Like, so I guess that I just wanted to, like hear your thoughts about that.
Mary.
Yes, thank you. I really appreciate you bringing up that essential labor and the care work. And, one thing that we saw during the height of the pandemic and even the beginning was that home care workers, I'm a home care worker, and many of the women in the Ain't I a Woman campaign are home care workers. They were being called essential workers. They were being expected to go to work. And yet most of us were not being provided with any protective equipment, any PPE. I have a friend who works in home care who received one reusable mask from her agency for the entire pandemic. That's all she ever got. And it really just shows, that even for the home care workers who are at least labeled essential workers, there was really no support to the extent that in the Ain't I a Woman campaign, we actually fundraised and distributed through a grassroots system PPE to hundreds of workers, both downstate in New York City, as well as up here in Buffalo. And New York, as we know, has one of the largest economies in the world, has a larger economy than some countries. So if these tiny worker centers can source and purchase and distribute masks to essential workers, there is no excuse for why Cuomo could not do that for home care workers, let alone for as well domestic workers and other essential workers.
Yeah, of course. I mean, I think what you describe is all. And I just want to add a couple more things. I mean, one, the dramatic situation of so many home care workers and domestic care workers, but when they're migrant, and the interruption of their money, which means that not only they, but also all their families back home, are suffering. And now the fact that with the subsidies, now this big bill that has been passed, it's not clear that any are going actually to be entitled to receive this money, and so this is another issue that is very, very important, because it appears that in extremis, I mean, somebody is going to be actually receiving some help, clearly inadequate. But what is the relationship, of migrant workers, of women who are in the most precarious situation and also have a whole families, people dependent on them here and often at home in other countries, and they're not qualified to receive the support that they need to. And
Right.
that's another big issue that we need to talk about.
No, absolutely. I was just gonna mention that please also feel free to comment on each other. Like if you feel like, yeah, I would like to touch upon what Silvia was mentioning. My previous question had to do with this way in which certain sort of like decisions kind of like give us a glimpse of how there is this hierarchization of not only labor, but like within care work, right? Like between that care work that is considered essential, that care work that is not considered essential. But then I would like to take this one step further, precisely to speak about immigrant and undocumented women, which is like what we have been seeing like in the work that we have been involved with. What we have been sort of like witnessing is, I mean, Mary, you were mentioning the dismantling of the systems for the sustenance of life. I reflected on massive unemployment on the one hand, like, and the difficulties to access, like sort of like unemployment insurance, and then that those that work are hyper exploited. So what we have been seeing is that, like many of the people, like within sort of like migrant, immigrant families, what we have been seeing is that certainly there's massive unemployment, but also that there are these care chains, right? Like in which when some women, mostly immigrant women, are taking care of, like the elderly or children or cleaning the houses of other women, like then during the pandemic especially, that means that like someone in their family has to be taking care of their own children.
Yeah.
So right, like, so I have like like one liaison from the Undocumented Women's Fund. It's like 5 women, and the reason why the whole household hold together is just because one of them doesn't have children. And she could like keep working, right? Like, and then all the rest, like could not work, had to stay home taking care of the children of the other, right? Like, so I guess that what I want to bring the question to is not only the hierarchization between different types of care work, but also this massive amount of unpaid care work that especially falls upon the shoulders of like immigrant and undocumented women. I just wanted to like to hear what are your thoughts about how sort of like politically and organizationally we could tackle that issue that has been so salient during the pandemic.
So Jimena, I would say that in a way it has made visible something that many of us already knew, which was that the whole system just relies on unpaid labor of women, especially women of color, especially immigrant women, because what we're seeing is that, you know, in the Anti-Woman campaign, the home care workers are leading the fight, but it is a campaign that's open to any working class people that want to control their time and have some control over their time. And this is actually, you know, more and more people are starting to wake up to this issue of care work and of having control of time. There's one member of NMAS, National Mobilization Against Sweatshops in New York City, who was a high-powered, you know, working as an executive assistant for many, many years. But when the pandemic hit, she became her child's, you know, in-home teacher, and her child has a learning disability. So, you know, she was always trying to really make sure he was still getting the instruction that he needed. And she got fired because of it, because she was being expected to do 2 full-time jobs. And the boss was not happy that she was having to do the care work as well. And so I think that this has really, you know, laid bare the unpaid work that we often expect women to do anyways. And, you know, in Buffalo, you know, what you were mentioning about people watching each other's kids as best they can and trying to band together, that's definitely something that we've seen where people are just trying to figure out any way they can to survive. And I think it really has made clear to a lot of people how broken our care or non-existent our caregiving system in the U.S. is.
Yeah, I mean, it's really a scandal that, you know, the moment in the early 80s, women migrate massively into wage labor. It's the moment when they begin to cut, the government has begun to cut all the essential services like funds for daycare worker, for senior center, for people, for social assistance going to the home, to, you know, elderly who may be still self-sufficient, but they, or having some crisis, but they don't want to be institutionalized. All of that has been slashed in different degrees, but in every state, these are the first things that are being cut. And now, you know, we have the results of it. And I think, I mean, you know, the hope is that there's going to be a movement of women who's going to place this issue in the center, because this is going to become very, you know, the statistics vary. I've heard statistics from 2,500,000 jobs that seems to be accepted by everybody, 2 million women and 500,000 who had to leave their wage work because they had no services. They had to take care of the children or elderly or people with chronic disease. And we don't know, either they say 5 million, and we don't know how much at the end of the day, if there is an end, you know, how many are going to be able to go back and regain those jobs. You know, this is happening, affecting also academia at all levels. For instance, I heard that in the academic journals, the number of publications, the number of articles arriving from women has flattened. Right. I mean, women are not writing, are not publishing. They are now so busy with the family and so on. So I think that the need for a movement that brings together, you know, paid domestic workers who are paid a misery, who are you know, and with incredible hours of work and terrible conditions, still very few rights, even if there's more rights now on the paper, but in reality, particularly when they are living, you know, and every other woman who, in one way or the other, is an illusion that you can escape housework. Is an illusion, even if you don't have children, even if you never had children, you know, because you have elderly who become sick, you have friends, etc. And that issue has not really been, you know, addressed by the women's movement. I don't think it has been really addressed, and I think we need to, you know, now hopefully this the intensity of this crisis is going to make us aware. It's a big alarm bell that you cannot focus all the energy in changing also deal with the question of reproduction, with the question with the home, with the question of housework. Otherwise, it's a constant. Otherwise, you have workplace of average woman who goes day by day with tranquilizers and antidepressant. Women are the biggest consumer of antidepressant in the United States. There's been even a rise in the number of suicide, which is unusual because women don't commit suicide. I think we have too much sense of responsibility to afford to think of suicide. So I really think that this is the moment to intervene and to have a broad debate as to what we need, in what form, according to different locality, different groups of women, and the sooner the better.
I just want to respond to that, Sylvia. I really appreciate all of those comments and fully agree. And something that's question of, what is the right strategy or what are the right demands to bring people together? And,
Right.
Biden has been talking about $15 minimum wage. Many people talk about minimum wage, but or other types of reforms. But for us, we really feel like the question of hours, and like you said, both paid and unpaid, whether it's as a home care worker or you're in the home, whichever it might be, that really is something that brings all working class people together, whether you have a job, whether you don't. And that's also something that we've really been trying to struggle with a bit at the workers' centers, is sometimes people will say to us, well, why do you call it the workers' centers, or why do you call it International Working Women's Day if you also include people who are unemployed? And it's because working class people, working class people are working anyways, whether it's caring for, their families, whether it's taking care of their neighbor's child while their neighbor is working. Frankly, even just trying to get, the benefits that you might be eligible for through the state is a full-time job in itself, for how much time that takes. So I really appreciate what you said. And I just think that, for us, we've really found that this question of hours and control of time, really links in with workers from different industries, including those who don't have paid work, but who still are working class people.
Yeah.
I want to actually precisely jump upon that, Mary, regarding, I know that you have been framing this battle of home care workers as a battle cry that can sort of like appeal, like to many others, and you have framed it as, like a battle to end the 24-hour sort of like day shift and reclaim control of our time, right? And I know, Sylvia, that like you have been historically involved with the demand of wages for housework. So I guess that what I want to ask you is, how do you think that like these two demands sort of like relate to each other, and how collectively like you envision that like we could organize and sort of like push them forward?
Yeah. Maybe you want to go first?
Sure. I think that they fit together, really well, honestly, because there's two things. So when we say that we want to end the 24-hour workday, we see that the hours and the wages are inextricably linked. If you said to a home care worker, you should come in for 8 hours, we're going to pay you for 4, they would say, what are you talking about? Of course I won't do that. But the long hours obscure the low wages. If you say to a worker, come for a full day a night and work 100, you'll get $150. You're hiding the fact that so much unpaid labor is going on there. And I feel like that's the same thing that the wages for housework movement did, was to say, hang on a second, just because we're not getting paid for this doesn't mean it's not work. It's work that we're raising our children and keeping the household afloat, cooking meals for our family, doing the laundry. And I feel like that's so intimately connected with home care, because they're both about that reproductive labor that is just thought of as not labor. And I think it becomes especially clear when we look at the 24-hour shifts of other workers. Firefighters, many other industries have 24-hour shifts, and they are paid for all the hours, even if they are just on call for that time. But home care workers are told, oh, you're not working for half of the hours, you can sleep, or you can, take a break, even though we know that's not true, even though hundreds of home care workers have come forward to testify to the fact that they cannot take a break and that they are constantly caring for the person that they, that their patient or the person that they're assisting during that time. So I think they fit together really well, and the importance of recognizing, reproductive labor that has usually been either underpaid or unpaid at all.
And reproductive labor is also work that has no end. Because when you are responsible, for example, for the health of a person, you cannot really take a break. Because during the break, the person might fall, particularly if a person is vulnerable physically. The level of strain that is involved, because when we talk about care work, whether it is a child or whether it is an older person, etc., it's really one of the most extenuating type of work. And I think it's very important because it's really, I think you said it, the question of time and the question of unpaid labor are very, very profoundly, connected. And the fact that now, you have a whole generation of women like really working all day long, working with no time for recuperation, because they don't have, and even when they work outside the home, the work is so low paid. And there is a connection. I mean, there's a clear connection that their work is so devalued that when it's organized on a wage basis, it fetches the lowest wages and, the most difficult condition. So I think it's a very extremely important. And I think, and in a way, the COVID is also throwing light on that. But already in the last 15 years, there is a mythology that we need to go work against, which is women have gone out of the home. Okay, women go out of the home, but they also come back, number one. And secondly, there's been studies that have shown that even though much housework is now done outside, like fast food, laundry, etc., have been done outside, which means that the meager wages you get, you also have to consume them, paying because you're eating outside, because you don't have the time to cook. And of course, there's obesity, which then adds to disease. But in addition to that, what has been happening, and this is something that I don't think we have really put enough attention on, is that there's been a steady flow of housework back into the home. And one type of housework in particular has been medical work. There's been a whole way in which a lot of medical work that was done in the clinic, and that's why they can shut down so many clinics in New York, is now being relocated into the home. And for example, turns out that many factories that are producing equipment for hospital, medical equipment, are now producing medical equipment for the home. So the idea is that you can do your dialysis, at home, in the kitchen or in the bedroom, right? And the idea is that a lot of things so that you can reduce so well, this is a big saving for the public institution, right? So less hospital bed, more productivity. And meanwhile, you have a woman who in between working outside the home and taking care of people at home has to also organize to do the dialysis. You have a surgery today after the you don't spend a kind of week of recuperation. Now you go back home and the wife mostly is being instructed how to take care. So we have to be really careful. You go to shop, and in addition to everything else, you have to weigh your food, etc., etc. There is actually a hidden, return of elements of housework, of reproductive work that are not really being thematized. They're not really being discussed, but actually they are adding to the workday.
Right. Actually, I'm thinking, you know, like how, in terms of like organizing strategies, going back to the whole discussion about the length of the working day, right? Like that for, I don't know, for the Marxist tradition for a long time, you know, like it has been a crucial kind of like question,
Yeah.
and it has been thought about a class demand, not a sectoral demand, right? Like, but a class demand. However, our discussion points that it seems to be something else at the same time, right? Like not only, I guess, a class demand, but something else. Um, and you know, like what you are pointing to, Sylvia, about all this labor being put back into the home, or this outsourcing, right? Like,
Right.
I
Which
guess
they
that,
can do, because it's unpaid,
right, right, exactly.
which is not seen as work.
Exactly. But in terms of organizing is my question next, right? Like, so then, you know, like, what do you and Mary think that could be, you know, like the organizing strategies to address this? Because, I mean, is it, you know, like going back to the demands, is it wages for housework, you know, like the horizon? Is it something else? You know, like, what do you think about organizing strategies and sort of like collective action to address sort of like this crisis of care work that is at the heart of the system? Do we have Mary here, or we lost her?
I don't know. She's
Okay, she's coming back. And I guess what I wanted to, I mean,
maybe I can start if you want in the
yeah,
meantime.
yeah, sure.
So I would say that has to be a combination of things, really combination of things. And that's why I think we need also a very important debate, because it may take different form. But it seems to me there has to be on three fronts. The change has to occur simultaneously on three different fronts. One front is the question of resources, and that's the wages for household question. There
Right.
has to be a recognition that this is work, and now it's done under condition of incredible poverty. And now, is the only support that we receive is like the child tax credit. That's what the Biden proposal, right? And in the past, it was tax credit that usually went into the male wage, right? And the issue is people are doing the work, they should receive the money. And
Right.
I know in Scandinavia, for example, there has been a lot of sharing, men, women sharing the household, so sharing paternity leave, maternity leave. However, many women I've talked to are complaining, saying, well, the men don't do the work. Now we share, but actually they don't do the work. We
Right.
still do the work, except that now we receive less, because now with the issue of equality, but anyway, so one thing is the resources, and we need a debate on how they're organized, how they can be distributed. That should be a decision that also comes from below. Second, the services, but there are two services. These are services that we need to be able to also have a voice, on how they're organized and what kind of service. We cannot allow just the state to decide what kind of child care, what kind of care for, because we know that they will be organized in the cheapest, most unsatisfactory. So there has to be in the feminist movement also an organizing, so that we have ways to intervene and ways of controlling. And ideally, this can take place also with healthcare. I know there is a great dissatisfaction. I've been talking to so many women, for example, with the healthcare that we receive. This is a very, 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 very poor system. And it's not only because we don't have a single payer, which is bad in itself, but also because when you go to the hospital, for instance, it's a struggle. And I know that the Black women have been in the forefront of, denouncing it. But in other ways, I think it happens to us all, because there are protocols that have an economic logic and the logic of accumulation. They are not a logic of our health. They are not the logic of really. The logic is sending us back to work. So services, yes, healthcare, but finding ways in which we can also have control. And third, that's the question of commons, of cooperating, changing, restructuring the way we organize our reproduction. But in terms of the work itself, I think that putting an end, to the unpaid labor, and I think we can organize fantastic campaigns. I think it's a very scandal, and sorry, I'm ending here. It's a scandal that this society spend billions and trillions, in armaments, and nothing, and almost so little. The way they vilified women in the 80s who received welfare. So it's okay to kill people. It's not okay. That's a job that is rewarding. Producing arms, but taking care of children, taking care of them. Okay, we know this, but I think we need to have a movement on this, because I think it's a bit of a scandal that we don't have it yet.
I very much agree with you, Sylvia. And I want to add, one of the things that we've been thinking about a lot with the campaign is any person in the healthcare field will tell you, and probably any woman or any working class person will tell you, an ounce of prevention is better than any sort of thing down the line. And what we're seeing is that, people are being exploited so terribly. Many of the home care workers that do these 24-hour shifts are getting injuries or getting illnesses from these, from this terrible amount of exploitation, that they then, end up needing home care services themselves, where before maybe they could have been healthy, and so whether, things like hypertension, things like insomnia, stress, you mentioned, right, that go along with these long hours and these bad working conditions. And so I very much agree with you that it's important for us to, think about the restructuring and think about, when we're talking about services like healthcare, I think it's important for us to also think, how can we even prevent some of these problems that, the government would rather just let us get these problems and then they can, make some money off us later down the line. But I also would just like to add, in terms of strategy, which you're asking, Jimena, one reason that we feel that, the strategy of coming together around control of time and coming together around the importance of care work, whether it's paid or unpaid, one reason we feel that's really important is because we know that this system is not going to work for us. We know that there's no way that under capitalism, our children will be cared for and our elders will be cared for and we'll have time to rest. We know that that's not going to happen. And so a question that we've been asking is, what kind of reforms can we put in place that, instead of making the system stronger or just making the exploitation a little softer, what reforms can we fight for that really expose the system as what it is? And the 24-hour workday, I think, does a good part of that, because when you say to somebody, 24-hour working, this is what these women are being forced to do and paid by the government to do, I think it really opens people's eyes a little bit. And then even further down the road, when you're talking about how these women should have payment for all of the hours worked and should be able to have rest, I think that it's a very small leap to say that we should have wages for housework even in our own homes. Why is it only work if I do it at someone else's home? It should be, considered work and paid either way. So I very much agree with you, Sylvia, about, the need to, come together for resources, for the payment, as well as, cooperatively figure out how we can, restructure for a better way. Jimena, I think you're muted.
Thank you for letting me know. I was saying that I would like to touch upon the question of the commons that I believe that both of you sort of like referred to. Yeah, so how, I mean, and it follows up from the previous questions about like organizing a strategy. And how can we work towards collectively towards the reconstruction of the commons, since, like that precondition called collectively itself, like has been jeopardized, like the possibility of like acting together. Like how can we collectively organize towards rebuilding the commons, and especially like given, as we have been discussing, that this idea of having, for instance, a workplace, right, like where you sort of like see the conditions like a factory, like, and you see the conditions of other workers, and then you kind of like, it's a space to come together and so like build commons and struggle, like a great community. I mean, many workers don't have that, right? Like, and as Silvia was pointing out, a lot of actual care work is being put back into isolation, right? What we have seen during the home care workers, and also sort of domestic workers were really, and even just like, women doing unpaid care work, really going into emotional crackdown because of isolation, right? Like, and this difficulty of coming together and seeing each other, seeing reflected, like one's own position in the other, right? So I guess that my question is about organizing again, like how can we organize under these conditions, and to how can, like how can we rebuild the commons? What organizing strategies can we use to rebuild the commons?
I would like to touch on it, but on your question, I'm going to answer with things that I've seen some of our downstate worker centers do. Just because our worker center is so new that we're still kind of finding the exact ways that we are going to address this locally.
Right.
But downstate, we've really seen how the worker centers prioritize making sure that if someone wants to participate politically, that's something that's going to be possible for them. So for example, after a rally, there would always be food at one of the worker centers where people could go back and discuss, how the rally went. Or if there's a meeting of home care workers, which, as you said, a lot of workers are in their own, a lot of workers are isolated. So if there's a meeting of home care workers at the center, to have a child care room where if someone needs to bring their child, that they can have a way to do that. So I think that on the day-to-day level, those kinds of things are very important, that as a community we come together to address those as best as we can. I also think that the truth is that our ability to do that is limited by how exploitative the system is, and so I think that's why it's so important that so for example, even when the Ain't I a Woman campaign was passing out masks to home care workers, there was still really an emphasis on this this shouldn't be the way that it is. It shouldn't be that this tiny organization is pooling together all the resources to provide materials that the state and that the your employers are supposed to be giving you. And so really putting the blame on where it should, putting the blame where it lies, and being clear that this is not a sustainable system, but at the same time, trying to prioritize as much as we can, looking out for each other and supporting one another while we struggle towards that different way.
Yeah, that's again, I agree completely, because you have to move on two levels. Because if you just have, communalism and cooperation without having more resources, you're just redistributing the poverty in a different way. And so you need,
Right.
first you need to have the resources to have communalism, because that you have to expand this, and it's like it's very much part of the same process, because to have more cooperation gives you more power towards the state, gives you more power to make those demands, and also to be together, cooperating. You don't feel you're not facing the same crisis alone, so it really gives you much more strength. But at the same time, you have to have more resources. And then, there are so many different ways, because it has to do with housing, to having collective spaces, trying to create collective spaces also in the buildings where we live or not live, and also try to force different kind of buildings. And, there's both the whole issue of urban gardening and, and okay, daycare where people from different families, different neighborhoods come together. So I think this is possible, but it's possible only if a lot of other things have to happen. Reduction of time at work, because if you don't reduce time when you go to work outside the home, you don't even have time to do things in the community. So in order to be able to do things in the community, you also have to not work 24 hours. More resources, so you're not, stretching what you just don't have, and then seeing how do you apply in very different ways. But I think the idea is that we don't confront the struggle together, and we cannot work and organize powerfully when we live all separated, when we go on this very individualistic type of lifestyle, and the private, being afraid of putting things in public, wanting to maintain your privacy of your home and all of that. And I think that kind of opening up and creating spaces. I'm very pleased to see that now the assembly, the idea of the assembly, is becoming more common, because I think the kind of making decision collectively, creating forms of self-government, creating forms of making decision from below collectively through assembly. That's very, very important.
Absolutely.
Yeah.
Thank you so much. Well, I mean, I actually, the last thing that I would like to mention is that I really, I'm happy that we got to this point because precisely what we are working with, like with the Women's Strike NYC and also all the localities that have joined us today, the invitation for today was not only to come together for a multi-hour tiring broadcasting, but it was like a political, like sort of like proposition, and what we have been putting in the table is the need to actually share resources, right? Like as Silvia was mentioning, like pooling resources, means saying we might be like grassroots initiatives, right? Like that are very localized and responding to what is proximate, right? Like and politicizing what is proximate. But then, like if we come together, like as sort of like decentralized and non-hierarchical, as a non-hierarchical network, we can pool resources, like we can have, we can share experiences, we can organize in common. And well, that's the invitation.
Yes.
And I look forward to continuing this conversation, and thank you so much for joining us tonight.
Thank you, Mena, and
Yes.
thank you, Mary.
Thank
and let's
you.
keep in touch. I'm so happy.
Yes, me too.
So
Well, we definitely need to keep in touch. And Jimena,
Yeah.
I watched some of the earlier program. This has just been such a beautiful day that you all have put together. Thank you so much for for bringing in these connections, and we definitely all need to stay in touch.